how would you diagnose obstructive azoospermia?
So the semen analysis gives us some other important features which we can look into the patient and a profile to think whether it's an obstructive form of azoospermia or a non-obstructive form of azoospermia, like the presence or absence of fructose in the semen sample. So, and also the basic examination of the patient, examination of his testicles, the size of the testicles, and also the vas difference will give us a basic picture. And if the suspicion is more towards obstructive azoospermia, it is always added on with another investigation of choice, either as a form of an MRI pelvis and also or a transrectal ultrasonography to look for any congenital malformations which might be there in the genital tract, which might be blocking the pathway of semen transport.
So the ejaculatory duct complex is delineated radiologically to find out if there is a block.
Yes.
And if there is a block, what would be the way forward?
So the blockage can happen at different levels. If it is at the level of the vas or at the level of the vas or the epididymis junction, then they can be repaired through micro surgical techniques called as vasovasostomy or vasoepidymostomy. And if the obstruction is at the level where the ejaculatory duct joins into the urethra, the final point, so there are endourological procedures. So these are basic endoscopic procedures which are done as daycare, which can open up these areas and like in the form of, there is a blockage in the form of a cyst that can be opened up, and the patient will have a good ejaculation right after that, and sperms would be available very easily.
So transurethral resection of ejaculatory duct is a possibility.
Yes.
If the obstruction is at the level of the ejaculatory duct opening into the urethra.